Hey there, folks. I'm Eric Osberg, and I'm the Rural Rebound Initiative Coordinator for Otter Tail County. We're back with another Better Together again, and today we have two doctors from Lake Region Healthcare in Fergus Falls, Minnesota. And we've never done this before where we had two people on at the same time, so hopefully this works. First of all, thanks to both of you for joining us and hopefully getting some good information out there. I'll start with you, Dr. Schmid. What are some of the changes that you have implemented there at Lake Region Healthcare to prepare for the whole COVID-19 situation?
So we started changes about a month ago, implementing things such as temperature screenings to make sure that people weren't having any sort of respiratory illnesses, things like that, before they would even be able to come into a regular appointment. More recently, we've started things like patients are being masked at the door. All the staff is being masked, as well as employees, or sorry, all staff is being masked at this point, and employees that don't have direct patient care. We are also working to expand our services into different areas that are what we call COVID managed, areas that we know that patients would be able to be more spread out and less have less chance of running into more patients and providers and things like that. So we've expanded into our Battle Lake area a little bit. We reopened our outreach clinics such as Battle Lake and Ashby. We're seeing appointments by schedule for some of the specialties at our walk-in clinic are some of the big things we've done.
And out in front in the parking lot at your Fergus Falls facility, anyways, there's a lab tent or a testing tent, and that might be a little bit intimidating when you drive by or when you drive in. Can you explain what that drive up tent is about?
So for us, we found that some of our patients didn't want to come in and get their routine lab work done just for fear. So it was just an idea to try to get a little bit more controlled area that they could come in and get their lab work done and just basically drive through and drive out.
Okay, so I'll turn it to you now, Dr. Overgaard. Before we started recording the conversation, you had mentioned something about the tent that I can't remember the words you used exactly. How would you explain the tent that you guys have out in front?
Yeah, I mean, two things. Like Naomi mentioned, one is that we want to make sure that people aren't overly anxious about coming into the facility thinking, oh, is this somewhere I'm going to run into a sick person? And so they had concerns that prevented some of them from getting their regular labs. And it is reasonable to try to keep people out of the building to what degree we can. I mean, that's the whole point of the stay-at-home order. But we don't want people to have the impression that we're turning into New York and that we've got a field hospital out on the parking lot or something like that. It's really not. That's not the intention at all. That's purely a measure that's there to promote safety and help people feel more comfortable about getting their regular tests done.
And again, I'll pose this to you, Dr. Overgaard. What are you anticipating? What do the models show? This is a moving target, and it's guesswork, educated guesswork. But what do the models show? What should we expect in Fergus Falls, Otter Tail County, as far as cases moving forward?
You bet. So, like you mentioned, tons of caveats here. This is a guess. These statistical models are developed by epidemiologists that aren't really, the purpose isn't for hospital planning and what have you, but they're based on good information that comes out of areas that have seen outbreaks before. And they use understanding about how this infection spreads and what the makeup of the community is and what sort of social distancing measures are currently in practice. So when we initially started running some of these models, a few weeks ago, it looked like our cases would probably be starting to rise by now. We'd be having patients in the hospital, and sometime toward the end of the summer, this would be tapering off. But more recently, actually, what we're seeing is, and this is a good thing, this is a result of the social distancing. Our peak numbers that we expect to be in our hospital are projected to be quite a bit lower than they initially had, but it's also going to take quite a bit longer to get through. So, we're looking at starting to build cases up probably starting mid to late May. We're going to start to see some more in the hospital. We haven't had any in our hospital yet. And then they'll rise up and peak sometime in late July, early to mid-August maybe, and taper off well into the fall. So we could see a pretty sustained period where we've got quite a few patients. But again, that number is a lot less than what we'd seen initially. So we've been really encouraged by that. And we've been speaking to some of our regional partners too, other healthcare facilities, and they're seeing similar things in their models going forward. There's been a pretty big effort, in this region to try to ensure that we're able to do what we can to coordinate care. And so we've been having a lot of those conversations with our folks in Fargo and St. Cloud and Alexandria and those types of places about, how can we share patients, share resources, share some of the kind of coordinating efforts around this. And they've all said similar things again about what their models are showing. So that's reduced our anxiety somewhat. However, it's worth noting that those numbers are still a lot higher than what, in terms of hospital numbers, still way higher than what we usually see. I know a lot of folks are really anxious to kind of get back to life as usual and get out of the house, and I'm not any different from that standpoint. I would love to have just a full day of patients in the clinic or the hospital and go about my day as usual. But, when we look at what the effect these social distancing measures have had on our modeling and really playing out in real time in other communities, it's really important and it's really working. So I hope that we can continue to take this seriously and I'm understanding the importance of the economy and the stress that this is putting on people. We have to also find a safe way to do this. Lives really are at stake from what we've seen. And there have been some good, stories out there in the news about, neighboring cities and neighboring states who've used these measures differently and then employed them at different timing, in terms of stay-at-home orders and school closures and all those kind of things. And it makes a dramatic difference. It can be the difference between stacking patients up in the hall and having to choose who gets a ventilator and, maybe having a manageable hospital census where you can provide care safely for your patients and your staff.
And so I'll ask you, Dr. Schmid, and if you don't feel comfortable answering this, I apologize. But when I hear about flattening the curve, there's a capacity, right? Each facility has a capacity, and it sounds like you guys are working as multiple facilities to share capacity. Any idea what capacity is right now, or normally, or what you have the ability to withhold if cases or hospitalizations should rise? And any idea what capacity is or where you're at right now as far as that goes?
I am actually going to punt that one back to Josh. Sorry,
Okay.
He's been really involved in our incident command and our surge planning, so he actually knows that information quite a bit better.
All right, my fault. I should have posed that to Dr. Overgaard. Dr. Overgaard, where are we at with capacity?
Sure. So our our usual census is somewhere kind of around probably a dozen or two, on a busy day on our medical surgical floor, 1 to 2 dozen. And we're looking at being able to expand our capacity to, 2-3 times that level potentially. That's pretty rough numbers. I don't want to give out a whole lot of specifics in that regard because that too is kind of a moving target. But we've got a plan to be able to use additional space in our hospital. It's their hospital rooms, but we've been using them differently. For example, our joint camp, elective surgeries are delayed right now, so we've got that space that's freed up. We've got a space that used to be our acute rehab facility that is no longer, and we've been using that for some therapies, and we can use those now for hospital rooms too if need be. So kind of expanded in that regard to be able to take care of some more of those patients.
All right, thank you. So Dr. Schmid, what advice, should I be wearing a mask when I go to the store? Should I, what advice would you give just average everyday folks who aren't sick right now or don't feel sick right now? What are some best practices? Should I wear a mask? Shouldn't I wear a mask? What should I be doing to try to do my part to slow down at least the spread of this thing?
Well, I think trying to stay at home as much as you can, especially during this recommended time by the governor, is a good idea. I think that washing hands, trying to stay away from people is good. Yeah, I am personally wearing a mask in public, and I do think it would be a great idea for people to do. I'm actually surprised that there aren't more people as I go to the store that are wearing them. So I'm glad when I go to a store and see that the person checking me out is wearing a mask, just because I do know that the number of people who are going to get sick from somebody who's asymptomatic is going to go down if we're all wearing masks. So the other thing is we're here and we want to make sure that people are getting the health care that they need. We're really concerned that people are not coming in for the things that they should be. Normally our ER and our walk-in clinics full with things like infections and chest pain and things like that that really we're not seeing, and we're really concerned that because people are postponing potentially those things, that they're going to come in and potentially be a lot sicker than what they need.
All right, Dr. Overgaard, I'll give you the last word, so to speak. Anything else that you think is important? If there's one final thought that you want to leave with folks, or a couple of final thoughts, what else should people be thinking about as they go about their daily lives?
Good question. So, really the main thing that I want people to understand, well, two main things I think that I want people to know that they wouldn't otherwise be able to know. And one is that we're working really hard to make our spaces as safe as they possibly can be. And that involves the things that you heard about before from Dr. Schmid, like the screening on the phone before people come in for appointments for symptoms, masking at the door, using separate spaces, spreading out our services and so forth so that we've got better social distancing within our facility. And in addition, within the hospital and in the emergency department, we're doing everything we can to isolate different types of patients such that those that may be infectious are not around those that aren't. So, having separate areas within the emergency department with seeing different people, those types of complaints, separate areas in the hospital. We've employed the use of negative pressure rooms, which is probably a foreign concept to a lot of people, but the idea is the air from that room gets sucked out and blown out the window and up into space. And so that the particulates that might be there and might be infectious aren't floating out in the hallway or recirculating in the building. And our facilities people have done an incredible job of installing HEPA filters in the air handling system, changing the way that the air flows and all those kind of things to really do a lot to manage that potential for spread around our facility. And the other thing is, just like Dr. Schmid noted, because we're working so hard to make a safe environment for people, we really want you to come in. We know that we've seen in other communities across the nation reports of people coming in with much more advanced illness, whereas maybe they would have come in on day one when their gallbladder started to get sick. They're coming in when they're on death's door. And that makes for a much more difficult situation to treat, potential for worse outcomes and all those kind of things. So we're here, we're working for you. We're going to be flexible about trying to schedule telehealth visits, get you into the clinic if need be and do all those things. But we don't do the community any service if we save all the folks that, are going to have COVID and everybody else gets sicker. So there's a balance that we have to walk there. And we're working really hard to make it a place that people can do that and feel comfortable about it.
All right. Well, thanks again for taking your time today, and thanks for all the work that you and your fellow employees and your staff and your facility are doing, and keep up the good work.
Thanks, Eric.
Thanks, Eric.